Trey, I've seen some of your programs on your sandwich board out front. Tell me about those programs.
Well, with programs, again, we really believe in being involved in the community. So one of the things that we thought about at Specialty Pharmacy was, what can we offer from our knowledge base, and what do people want to hear? What would people improve from, or what would people appreciate? And so I did a fellowship in anti-aging and functional medicine at the South Florida University School of Medicine. I just completed my fellowship last year, and what I thought was, okay, so I have this knowledge, how do I apply it within the community? So I'll tackle HCG, because that's one of the first programs that we've been offering. HCG is a product that is designed for weight loss. Well, you don't have to look very far to find folks who are overweight in our society. Is that poor food choices? Is that it's a lifestyle disease, okay? And so 70% of disease is lifestyle. And so when we think about things from a preventative perspective, can we fix this issue, or can we get ahead of the curve? We think about how can we achieve weight loss. HCG is one of those programs that we've been experiencing tremendous results from. Well, HCG is a hormone that we produce, but it's produced in large part in pregnancy. Okay, so a pregnant lady will produce 1 million units of HCG a day, and HCG trains the body to burn abnormal fat. Okay, so it's not burning normal fat, it's not burning structural fat, it's burning abnormal fat. So that would be belly fat, hips, thighs, upper arms, places where fat is stored, where when you do your typical diet, you may lose a little bit of weight, you look sullen, you feel very, very, very weak, but you didn't lose the belly fat, you didn't lose the fat on your hips and thighs and upper arms and those areas, because that's an abnormal stored fat. And so HCG unlocks that and helps the body burn that. You can get a lot of information about the HCG plan on our website at www.sprx.com. There's more information there, or you could actually schedule a consultation, which is another thing that we do here. Well, from time to time we have patients who come in and they have a question. As a pharmacist, consulting is something that I do routinely. And so that would be consulting or counseling on a prescription medication. What are its interactions? How is it stored? How do I take it? Those types of things. What are potential side effects? And that's routine pharmacy business. You're going to get that from any pharmacist anywhere you go. One of the things that I've been focusing on is consultations with bioidentical hormones. So bioidentical hormones are hormones that mimic the identical hormone that's produced in the body. Okay? Structure per structure, they're the same. And so bioidentical hormones are something that we offer here at Specialty Pharmacy for perimenopause, premenopause, menopausal patients, andropause. And so we'll routinely have folks come in and maybe they're having night sweats and hot flashes, or dryness issues, or libido issues, or migraine headaches the last 2 weeks leading up to their cycle. Those types of things are ridiculously bad cramping. These are things that ladies come in frequently complaining of, and they're not finding relief from the synthetic therapies, from the conventional therapies. So they come in, we go over their chief complaints, and again, I'm a pharmacist, so I can't diagnose. So my idea is to say, these symptoms suggest ... And I fax that to the physician that we're working with, because I really believe in the triangle approach. Patient comes first, physician, and pharmacist. And if we all work together as a team, the patient wins. And so what I do is I make recommendations to the physician and to the patient. That may be supplementation with a nutraceutical or a pharmaceutical grade supplement that we offer. But the majority of the time, we feel like we can go a long way by using bioidentical hormones. Well, I joke around about this a lot. You know, when I fill a Premarin prescription or when I fill a birth control prescription, I never have a patient come back and say, you know, thank you so much, Trey, for filling that prescription. You did such a great job. The label was perfect on that bottle. I just couldn't believe how straight it was. And you even counted to 30 right. You did a great job. I never hear that. But I tell you, when you get someone's hot flashes to go away, and when you fix their dryness, or you fix their libido, or you help them with fibrocystic breast disease and those types of things, you know, the amount of cards and the amount of people that come back with glowing testimonies, you know, that's why I do what I do, and that's why I stay up late at night reading. That's why I get up early and go to work, because it's those types of results that we're looking for.